Mammograms are an important tool for screening for breast cancer. And in patients who have symptoms, mammograms are an important tool for making a diagnosis of an underlying cancer. Now, we're very privileged here at Breast Cancer Answers to have several videos from, frankly, probably the world's leading breast radiologist and mammographer, Dr. Laszlo Tabar. So I would not be so presumptive to even begin to speak for Dr. Tabar, who I know has addressed this issue. But what I want to do now is sort of give you the surgeon's view about how effective mammograms are at detecting breast cancer. Number one point I want to make is when we look at the lowering incidence of deaths from breast cancer in the United States, the primary reason in the United States and other Western countries has been the use of screening mammography. It's number one, and it is effective. But patients, unfortunately, have the feeling that mammograms are 100% sensitive and 100% specific, and that's simply not the case. We have not yet invented a single technology that I would call the holy grail of breast imaging. So mammograms are really important. Patients should be having digital mammograms. I think film screen mammograms are a part of our important history, but the contemporary standard, in my view, is clearly digital mammograms. Digital mammograms are outstanding at finding fine little microcalcifications that can suggest that a cancer is there. Now, I have previously talked about microcalcifications and pointing out that not all, certainly not all, calcifications or microcalcifications in the breast are breast cancer. But in fact, some can be, and particularly if they're branching and clustered and a big fancy medical word called pleomorphic. So mammograms are going to be very important for seeing microcalcifications, in my view, for years to come. Now, mammograms work the best the more fat there is in the breast. The more fatty tissue replacing the dense glandular tissue, the accuracy of mammograms goes way up. The more dense, then, conversely, the more dense the breast is, the less sensitive mammograms are. In women who have fatty replaced breasts, typically seen in postmenopausal women, probably the accuracy of mammograms is up in the 90 to 95% range. You get down in women in their 40s who have very, very dense breasts, who are thin, don't have a lot of fatty tissue in the breast, probably then the accuracy of mammograms could fall down potentially into the high 60% range or low 70% range. Cancers on mammograms are white. The dense breast tissue is white. And if you have white on white, you may not be able to see the breast cancer at all. Therefore, ultrasound is an important other tool. And under development for the past few years has been ultrasound technologies to scan the whole breast, analyze that, and to see potentially areas of cancer that cannot be seen on the mammogram because the cancer can be white on white. These technologies are not yet ready for prime time, nor are they approved yet for screening, but certainly if there's a palpable lump in the breast and the mammogram doesn't show anything, ultrasound is mandatory at that point. Another technology being looked at in women who have very dense breasts is going to be using nuclear medicine isotopes, molecular imaging, if you will, of the breast. That's in trials going on right now. I'm very optimistic about this technology, but again, it's not ready for prime time. Hopefully in the next year or so it will be. We need to lower the radioactive dose of the isotope down to a much lower level before I think there'll be widespread use. So what's the summary or the bottom line of this particular video? Mammograms are really important in detecting breast cancer. Mammograms are not the be-all or end-all. The more fatty replaced the mammograms are, the more accurate they are. Conversely, the more dense the breast is, the less accurate they are. It is our number one weapon against breast cancer. And just because they hurt, and I know they do, and I hear patients complaining to me, doesn't mean you shouldn't be getting your mammograms. And as I've said repeatedly here at Breast Cancer Answers, if there's a palpable lump there, then more is needed than just the mammograms. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.